I mean, I'm not sure we could start these 2 days of conversations with a better discussion than what we just saw between High Commissioner Grandi from UNHCR and Mindy Bells from World Magazine. I think it really sets the context for everything that we're going to experience, but also learn from, and hopefully be able to discuss over the next 2 days. So let's move into the live conversation, the reaction, if you will. And I am just thrilled to welcome two people that I think are run some of the most important organizations in the refugee resettlement space, both here in the US, but around the world. First, I want to welcome Krish Omara Vignaraja, who is the president and CEO of Lutheran Immigrant and Refugee Services, and then Edgar Sandoval, senior of World Vision. Edgar, Krish, thank you so much for joining. Really appreciate this. So let's jump into this, and because we're coming out of, well, let's hope we're coming out of COVID-19 around the world, and I know it's going to be a long path ahead. But from your respective organizations' positions, how has COVID-19 impacted your operations? But I think even more importantly, how do you see COVID-19 impacting migration around the world and everything that the High Commissioner just spoke to? So, Krish, if I could start with you, please.
Yeah, Ali, thank you so much for hosting this important conversation. Thanks for having me. The pandemic has had, obviously, kind of a number of effects, everything from creating a reason or rationale for Title 42, which was the public health emergency order that the High Commissioner referred to, that's being used at our southern border, to operations of LIRS. So I'll start with, refugee resettlement. This fiscal year, though President Biden increased the presidential determination to 62,500, unfortunately, here in the U.S., we only accepted, 11,400 or so. Just to give you some context, the previous historic low was set by President Trump at 11,800 or so. So this first fiscal year of the Biden administration, we are seeing, as a result of the pandemic, as a result of building the capacity, and frankly, as a result of not putting in place the resources necessary to build the pipeline, we saw a historic low in terms of refugee resettlement. At the southern border, Title 42 has been used to reject populations from migrants coming from, the Central America to Haitians, even in the last few weeks. Here in the U.S., it has impacted our ability to serve our clients. So we've tried to be creative. So rather than check-ins happening in living rooms, we've done porch check-ins. We've made sure that we had the quarantine protocols in place. So our capacity of even helping unaccompanied children was affected because we needed to reserve some placements in order to make sure that we were taking precautions in light of COVID. And so those are kind of some of the impacts of the pandemic.
Edgar.
Yeah, thank you, Ali, for inviting World Vision to this important conversation. It's an honor to join Krish today. Listen, as the High Commissioner mentioned, it's really a series of factors combined with COVID sending families to the brink and causing this forced migration. I just would like to spend a couple of minutes on some context. Before COVID, we were seeing a decline in the overall number of people in the world that were living in extreme poverty. And we know that extreme poverty is a causal effect of migration. Well, it was declining throughout the world. However, we were also seeing extreme poverty almost retreating to some of the world's most challenging places to be a child. These are places where there's a severe lack of infrastructure to help people, even with the most basic needs, things such like clean water, access to food, access to healthcare. These are places like Haiti, Somalia, and South Sudan. And you hear these sometimes are called fragile countries. Now, World Vision works in these countries, but these are the places where it's sometimes the hardest to get help to those in need. In addition to that, we have seen an increase in conflict, right? In many places, making it very unsafe for people to choose to remain home as a result of crises that are lasting not for months, but sometimes years. Think about Syria and Afghanistan. Further to complicate it, increasingly unpredictable weather patterns that are causing either droughts or flood. Well, they add a significant level of uncertainty to families' ability to have reliable livelihoods. This was all going on before COVID. And they were drivers of the highest forced displacement of people in our history, right? In fact, it was reported recently, global refugees and displaced people surpassed 80 million last year. Now, on top of that came the global pandemic, hitting countries with little to no safety net. And so people who were already on the edge of survival now face additional income loss, sickness, death of a family member or caregiver. And the result, well, it's a dire situation, which is an added driver to forced migration and causing humanitarian needs to increase. And now extreme poverty is forecasted to take a step back to levels not seen in 30 years. And perhaps I can just illustrate briefly with an example that's very close to home, because all this theory came to life in a very powerful way, unfortunately a negative way in Central America. These examples of multivariable drivers. Central America, socioeconomic conditions and violence were already there, right? And before COVID, there were 3 years of dry seasons. Then 2020 was devastating with COVID and 2 back-to-back hurricanes, category 4 and 5, affecting 7 million people. With the hurricanes, people lost their loved ones, their crops, their access to markets. Through COVID, businesses were shut down, leaving people unemployed, unpaid. Child malnutrition levels, which were already bad, are getting worse. And so coping mechanisms such as skipping meals and selling assets, well, they're no longer enough. And they lead to this humanitarian crisis that we're seeing. And that's why we're seeing historically high numbers of people arriving at the US border. But I'd like to close it with this, Ali. I know from my own experience that no one wants to leave the people they love and the places they know. No one. But they will if they cannot find a hope for a better tomorrow or a way to feed their families. This was my own experience as a teenager in Venezuela. My family fell on hard times. We started skipping meals, selling assets, but it wasn't enough. So eventually I had to leave. And even though I didn't want to, I did move back to the US, where I was born and had left as a toddler, came back with $50 and no English. And it was like being in my own an immigrant in my own country. And I can tell you, I didn't want to come. And the first few years, it was not fun. So that's why we have to unite and come together to try to solve these big problems that the world is facing. I have good news, though, as far as your question on operations on the ground internationally. We are still on the ground. Our communities are indigenous to the places where we work. And so we've been able to keep our operations going and helping the people that are facing so many challenges.
So one of the High Commissioner spoke to kind of 2 types of reforms that were necessary in his conversation with Mindy Bells. One was a set of reforms to the U.S. asylum system, and he was talking about needing to be both, I think, effective and humane. And the other was a different perspective on, or better perspective, I should say, or a better approach in terms of addressing root causes of migration. So I thought I would kind of give each of you kind of one of those questions. So Chris, let me turn to you first. From your perspective, what are the asylum reforms that are needed here in the U.S. so that we do have an effective but also a humane system?
Appreciate that question. So I think there are certainly 2 main areas in terms of the access to the opportunity to even make an asylum claim. It's important to understand that there are 2 policies that were put in place by the Trump administration and still today, essentially remain in place. So one is Remain in Mexico, which is essentially a policy which is barring asylum seekers from accessing a legal right, which is to come to the U.S. and on American soil make a claim of asylum. The idea that people are now having to sit in squalid conditions in Mexico, be subject to the vulnerable gang violence that, you and I both have observed. I got a chance earlier this year to go to McAllen, Texas, but also to visit Reynosa, Mexico. And a week after I visited, that very plaza was ridden with bullets as a result of, these poor migrants who are find themselves in the crosshairs of, criminal gang activity. And this is where the U.S. needs to make sure that we meet not just our international legal right kind of obligations, but asylum is a legal right that's identified and recognized by U.S. law. And then the second piece of that is Title 42. Dr. Fauci himself was very clear about the fact that immigrants are not bringing the pandemic to our soil. They're just not. The idea that we have quarantine protocols should give any American out there assurance that Title 42 does not need to be in place right now in order to protect Americans. We have COVID quarantine protocols in place. And so, I know that this is being litigated, but it is deeply troubling that even this administration, even a few weeks ago, used this to deport thousands of Haitians. And then the final piece is, it isn't a matter of simply being able to access asylum in terms of making a claim and then entering the backlog. The fact that we have a 1.3 million backlog suggests that these asylum seekers are still not accessing their legal right. And so this is where we need to see an investment in the resources to make sure that there are sufficient asylum officers that are adjudicating claims and that there is a legal process so that people can have review and ultimate determination in a timely fashion.
Thank you so much, Christian. Edgar, from your perspective, because I know that World Vision does a lot of work in country in Afghanistan in particular, High Commissioner spoke to the need to make sure that we don't see an even larger humanitarian or migration crisis from Afghanistan. So what are some of the root cause solutions that we need to be thinking about in Afghanistan itself?
Well, so in Afghanistan, we have so the World Vision model, Ali, is to first start with a humanitarian emergency response and then transition into recovery and development. In Afghanistan, right now, our response is 100% humanitarian and relief in nature. So perhaps I'd like to address the question on root causes in migration, sticking with the example of Central America.
Perfect.
Where we have seen, so what we believe is needed is a dramatic shift in how we approach the problems, these problems that I mentioned of fragility, development, humanitarian response, with a new mindset that puts resilience, a resilient approach at the center of everything we do. In fact, we've recently rolled out what we think is a very ambitious framework at World Vision that we call Hope at Home, building resilience in Central America. And this framework addresses the root causes of poverty and crisis, both economic and, as I mentioned, environmental. What it does, it empowers communities with the resources and skills to cope with multiple crises, multiple risks. It's multidimensional, so they need a toolbox, right? So that they don't feel forced to migrate. And what we found is when people are resilient and when they're equipped with these tools, they can bend but not break in the face of shocks, even when those shocks are coming one after the other, as I mentioned, with 2 category 4 and 5 hitting Central America. And so this comprehensive, holistic approach goes beyond short-term emergency response. We need to stay longer, commit longer, and therefore we need longer commitments of fundings so that we can see end-to-end change over time. Is this long-term presence in the communities that builds the resilience to continuous shocks? And it's going to require policy, strategic and programmatic approaches that are intentional in building this resilience. But what I will tell you is that there's light at the end of the tunnel, if you would. We have seen results in Central America that with increased support, like the one I just mentioned, families are less likely to migrate. In fact, in one community that we tracked in Honduras, we saw a 33% reduction in terms of number of families intending to migrate. And I think these are good signs. We just need to keep at it. We need a multi-sector partnerships, private and public funding commitments that are long-term. And I think together we can make a difference, Ali.
So we've got less than a minute left. So I have one question for you that you have to answer in, let's say I'll give you 5 words. What gives you hope? I'm going to count. 5 words. Krish, go for it.
The outpouring of American support. And I'll say this specifically in the context of Afghanistan. We've had more than 50,000 volunteers step up in their response just to help Afghan families who are arriving here in the US. It's amazing.
That's fantastic. Edgar.
Americans have always responded. That's 4 words. How's that? And I'm very hopeful that they will continue to. Like Krish said, they're responding in droves.
Well, I mean, I really want to thank both of you, Krish, Edgar. I really want to thank your respective organizations, Lutheran Immigrant Refugee Services and World Vision. You do incredible work around the world and across the country, and really you have some of the best staff that we just really love to partner with. So with that, I am going to do two things. Number one, I'm going to remind everybody to join the conversation on social media at hashtag LTW2021. And number two, I'm going to turn this over to my good friend and a National Immigration Forum board member, Mark Prosser from Northwest Iowa, somewhere in the vicinity of Storm Lake. Over to you, Mark.